We got stress cause we're striving, surviving, keep on moving to improving, rearranging. The whole world's changing, pandemic, systemic, rule making, rule breaking, disagreeing, now we're fighting or fleeing. Got a mind.
Hey, the stress divides me.
The stress divides me.
Wanna mind the gap, hey.
Wanna mind the gap, hey.
So why don't you help me?
We got stress conditioned by tradition, position, and religion. Do we listen? Welcome to Minding the Gap, podcast brought to you by Behavioral Sciences of Alabama. I'm Paul Bakke, licensed counselor, alongside Dr. David Barnhart, and we are going to talk about panic attacks and how we can, with some strategies to be able to maybe head those things off, and some exposure therapy practices that might be helpful. Dr. Barnhart, how are you doing today?
Good morning. I think I'm fine. I think I'm fine. No panic feelings.
Not yet.
No racing heart. No palpitations. Not having a heart attack. But those are pretty common symptoms when people have anxiety. It's not a joke. Because it feels like an emergency.
Feels like an emergency. It feels like not going to be able to breathe. Feels like it's not going to go away.
Mm-hmm.
And then once someone has a panic attack, there can be a fear of having one.
Yes.
That can cause those symptoms, and so it can be kind of circular, the process, and then worry about it, and different triggers create that. So what we're going to talk about today would be some strategies to cope with panic attacks, to be able to catch them earlier, and really the idea that we really want to be proponents for is for people to develop a skill set to be able to manage those without using pretty hardcore medicine.
Right. Reduce the probability, reduce the frequency, and typically what we see is people stop having panic attacks.
Right.
So it's,
and we see too that someone who goes to the doctor that's having panic attacks, they give them pretty strong medicine and start having it, and they take one, and so it's like, okay, let's work on taking less of those and becoming dependent less on those. And we want someone to be able to have less panic attacks and also less need to take this emergency medicine that's pretty powerful.
Yes, and a lot of the medications that are used for immediate results, of course, they have a very short half-life, so they ramp up pretty quickly and then they tail off fairly quickly. They're not long lasting. They don't go for 24 hours, anything like that. And so because of the nature of the medications, and we understand why people don't want to feel miserable, and they go to their physician, they'll get a prescription for maybe Klonopin or Xanax or some other benzodiazepine. It works pretty quickly. Some physicians will not do that. They'll prescribe something that may kind of knock the edge off a little bit, something even like an antidepressant that's a selective serotonin reuptake inhibitor. So they take longer to kind of get up to a level that is helpful, and it doesn't have that immediate 15-minute change from panic to panic stopping, so it's not nearly as reinforcing to take
right.
Take those medicines, but they're also not addicting. So we can become dependent on medications because the natural thing to do is when you feel bad is to escape the feeling.
Want to feel better.
Yeah. So
That's right.
take the medicine.
Yeah.
Right.
So going over some of the symptoms of a panic attack,
Mm-hmm.
we got shortness of breath or hyperventilation, chest pain or discomfort. You know, some people will
Mm-hmm.
think that they're having a heart attack.
Yeah.
If you've never had, I've never had a heart attack, so I don't know what that feels like.
Mm-hmm.
So if I have chest pain, I'm going to naturally think it might be a heart attack.
Yeah, that's right.
And so if I'm
Right here.
even if I'm not having a heart attack, I'm going to be pretty anxious about that feeling, and it's my worrying about it is going to make it worse.
Yes.
Trembling or shaking, choking feeling, feeling sort of unreal or detached, sweating, nausea, upset stomach, dizziness, lightheadedness, numbness or tingling, hot or cold flashes, fear of dying and losing control, or fear of just going crazy. So those are some symptoms that come up
Mm-hmm.
that may be signaling panic attack.
Right. So we obviously, when we experience those kinds of feelings, we're trying to find comfort, as quickly as we can. Let's get out of this. And as you mentioned, leads to the emergency room or to the physician, which is good. I mean, you go get an objective evaluation, and then it feels funny when they say, well, no, there's nothing wrong with your heart. We think this is anxiety. And, people sometimes feel insulted by that. It's like, oh, you mean it's all in my head? Everything's in our head. So
Yeah.
it doesn't.
all the chemicals that are going through your brain are in your head, and they're creating a sensation throughout your body.
It's not crazy. It's crazy.
Yeah.
Our brains respond by producing what the brain predicts is going to be needed to deal with the situation. So if a person is walking around with a high level of tension and anxiety anyhow, and you add an additional stressor, it can kind of take it over the top a little bit, and so then you get this sensation of tightness, and now we have an awareness of how we feel and a feedback loop.
Yeah. And we've talked about the gap between the trigger, and the feeling and the response to that, and then there's also the thinking. So, and we've talked about when we get this really uncomfortable feeling, our brain is trying to interpret what that means.
Mm-hmm.
Does that mean danger? Does that mean heart attack? And it doesn't know. It doesn't know the answer, because you can't diagnose your own self and do the tests on yourself,
Right.
unless you were at the hospital to find out if there's some kind of problem with your heart or you're having a heart attack. You just know it feels bad. So
Mm-hmm.
but the ability to predict what's happening helps us when, in the case of a car coming, if I predict that if I stay in the street,
I get
I'm
run
gonna get
over.
hit by the car,
Mm-hmm.
that helps me decide to get out of the way. And so the ability to predict sometimes is wrong. We're not having a heart attack. It just feels really uncomfortable, and our mind is trying to figure that out. So it's all part of the process.
Right. Self-protection.
And so then if, so like I said earlier, if someone has had a panic attack, they're really miserable. They really feel out of control. At a point where it's a panic attack, it's a physical thing. It's not, you're not going to calm down by any technique other than to just stop it. It's just ending.
If you wait long enough, eventually
it will stop. So that period of time feels like a really long time.
Mm-hmm.
And nobody wants to feel that, to get to that point again. So it's like any kind of trauma, some kind of memory is triggered about a trauma, and we do whatever it takes to stay safe from that trauma.
Mm-hmm.
Whether it's danger, if I've been robbed and go into another similar situation and I feel that and I get out of there. It's so the brain is remembering those traumatic things and then doing something to try to prevent it. The problem with the panic attack issue is that it creates some worry. You can't just get away from a situation, you might get robbed. You're still in yourself. You have to do, you can't run away from yourself. So we worry, and worry sometimes creates more panic. The thing in our brains that's trying to solve the problem creates a bigger problem, so that
And we might want to avoid going out because we get too far from the house, or we're too far from the hospital, or
right.
whatever. So then our lives become constrained.
Yeah.
And we don't get the exposure actually that we need in order to habituate and reduce the probability of anxiety leading to a panic attack.
Yeah. So part of what we want to talk about is habituation. We want to talk about learning how to get used to this feeling and this trigger.
Yes.
Without and to be able to, for your brain and your body to respond to it in a way that's helpful.
Yes.
So we talk a lot about exposure.
We talk about exposure. And by the way, we probably should say this is educational. We're not telling anybody to do anything. This is educational information. And if you're concerned, if you're thinking that you have panic attacks, anxiety attacks, whatever you name those, or heart attacks, see your physician. Find out do you have a problem that is physical. That's
right. Rule out a physical problem.
Yes.
Once you've ruled out a physical problem,
then you may
anxiety may be the issue here.
Yes. And if you can work with somebody that has been through this process with folks, then they'll have confidence and you'll have confidence that what you're doing is going to be useful. So you want to talk about some of these ideas that just sound counterintuitive?
Sure. Yes. And exposure is always strange and seems counterintuitive, because it's, instead of avoiding something, it's leaning into the feeling.
Exactly.
And so some of the things that we talk about would be, the cardiovascular, the circulatory issues that come up.
Mm-hmm.
And running in place for a minute was going to create that feeling of heart beating faster, get hot, you start breathing, difficult to breathe. And so you're creating that feeling to kind of habituate to the feeling of what might be anxiety coming on.
Right. So what we're really doing is learning how to tolerate physical discomfort that is similar to what we might experience. And everybody's a little bit different when they have a panic attack. So some people notice it right here. I was talking to some individual today, and they were telling me, well, I noticed it right here, the pounding right here. Okay. And so we're talking about, well, how can we generate some feelings like that? Now, if you're in really good shape, it's hard. If you're not in very good shape, you can get your heart rate up pretty fast. If you're in good shape, you might have to do some repetitious sprints or something to get there. But there we go.
And an example, I had a client that was just had a panic attack when giving a speech in class. Very, very good speaker, been
Mhm.
in several leadership positions throughout his life, college student, but got into a speech and just lost his place and started to panic.
Mhm.
And then ever since then, when he has to give some kind of presentation, that is now connected.
Sure.
So he came in to work on that. And so, and he had presentations that were coming up. And so he would do 20 push-ups and then do his speech.
Mhm.
And he's gasping for breath a little bit, and his heart's beating faster, and he's going through this while he's feeling
Mhm.
this sensation that's similar to what he had had previously. Now,
Mhm.
the connection between the heart beating faster and the shortness of breath is tolerated. He's learning to tolerate it, and he's still
Sure.
giving his speech, right? So
Right.
so
Right.
that's an example of
Mhm.
allowing this feeling to get to the point where he's habituating to it, so that it doesn't create this worry about, oh no, this is what, and now I got to, do all these other things that would make it worse.
Yeah, so that's the idea.
That's the
So
whole idea.
if there's a particular trigger, like going to make a speech, you're going to, and I'm usually dealing with some aspect of that, as I'm sure you are, with somebody in your practice. You're trying to help them habituate to a particular type of trigger. And in addition to simulating the circumstances, if we can add the physiological aspect to it,
Right.
it enhances the learning, and habituation occurs better.
Yep.
And we're less likely to have relapse. Now, I know we have a short period of time today, and what I would recommend, why don't we look at the hyperventilation part?
Okay.
There are a number of things we can talk about again, but in the respiratory, on the respiratory side of the house here,
Okay.
here are some things that we do. So we've got deliberate hyperventilation. So if you pant, and you can try it out. I mean, you're in control of your own breathing. So if you were doing this, you would try it out and see how it feels, and then understand what it takes for you to have an experience that's similar to your anxiety experience. So holding the breath. I have a recent experience with this, getting back in the swimming pool. Yesterday, the person that coached me years ago thought I should probably go to the deep end and do some drown proofing exercise, where you expel all your air and sink. And then when you feel like you need a breath, you go to the top of the water and grab a breath, and then exhale again until you sink. And so you're learning to go for longer and longer periods of time and trying to be relaxed. It's a very good exercise to learn how to be relaxed in the water. It's an exposure.
As soon as you start getting anxious about being able to breathe, you stop swimming correctly.
Exactly.
And you get more tired.
Yes, you do. It wears you out.
That's my experience. I
Yeah.
can go for a lap, and then I start worrying about drowning, and I get more tired. And when I do 2 laps, I feel like I've just ran 2 marathons.
It makes perfect sense. And a good way to understand what people feel like when they're having hyperventilation, they don't feel like they can get enough oxygen, is to just go for a swim.
Just go for a swim. If you're not a very good swimmer like me, and you'll know exactly what that feels like.
Exactly. Well, let's look at the last one here. Breathe through a cocktail straw, gradually decreasing the amount. This is one of my favorite techniques. for simulating that breathless feeling. And what we usually do is we'll have people start out with 4 or 5 straws. They just put them in their mouth and they just try to slowly inhale through the mouth and get enough oxygen. And then as they get accustomed to that, we begin to take the cocktail straws out. And some people can get down to 1 or 2 cocktail straws. And that's just on the edge where they begin to feel a little breathless. Right? And so that begins to simulate. Now, if you can breathe through 1 or 2, and if you also then move around some, you're going to be a little bit short of breath because you're barely getting enough oxygen to feel fine. Okay. And if you move around, you're going to use more oxygen. So you can simulate it, try it out. And it's very good technique for simulating that kind of feeling that I'm not getting enough air.
Yeah. So the idea is when that feeling comes with anxiety, there's this connection of I've felt that before,
Mm-hmm.
and been able to accept that feeling,
Mm-hmm.
and maybe that gives me a better chance to respond in a way that doesn't make it worse.
Yes.
That helps you go, okay, I just need to take some breaths, do some things to sort of focus on stopping it and getting calm and getting more regular with breathing.
So exposure, counterintuitive. So we're really trying to lean into the feelings, learn to tolerate them. And it turns out in practice, doing these types of things with some guidance from somebody that knows about it, knows how to do this, can counsel you and coach you along so that you decrease the probability of having a panic attack.
There we go. All right. So that's what we got for you today. So hopefully you've learned a few things about that. And one of the things I will say I saw there, being in hot rooms, and being able to habituate to that. We're not encouraging you to tell your spouse who likes it to be colder than you like it in your house. We're not telling you that you should say, well, you should just do some exposure and just get used to it being hotter. That probably wouldn't go over well. I know it would not go over well in my household.
Right. This is not applicable to every possible circumstance, is it?
So, but anyway, but this is very helpful for people who have anxiety and who have panic attacks to be able to kind of look at this information and research it a little bit further and maybe get some help with it.
Very good.
All right. Well, thanks for watching, everybody. Please rate, review, subscribe. We need more subscribers. We need more viewers. We need feedback and comments to help us bring you what you'd like to hear about. Have a good one.
Mind the gap, hey.
Won't mind the gap, hey.
So why don't you help me?